Leader of the opposition Dr. Mukul Sangma on June 2nd made a detailed inspection at the step-down hospital in Umsawli, Indian Institute of Management in Shillong, at Mayurbhanj complex and Shillong Civil Hospital on the facilities provided for the treatment of COVID cases. Dr. Sangma was accompanied by other members of the opposition. Speaking to media persons, he mentioned his visit to the various hospitals across the state to assess the situation from ground zero.
Our review meeting, which was convened by the Honorable Speaker, where important observations were made and all the concerns were shared with the government. And in view of that, what has been done and what was assured and what has been fulfilled, we wanted to at least know from the ground zero. That's why we definitely needed to go to the ground zero. We went to Giant Jails yesterday. Today we are here. Now certain necessity of ramping up the infrastructure related requirement were required to be done. What we have seen is that it is in the process. Still it is in the process. Whatever has been created are there, but what was needed more to save precious lives and to generate that kind of confidence amongst the frontline workers, they are still in the process of implementation. That is one part. Even as you see today, I think all those facilities for oxygenation and other things are still in the process. We have only tried to look at another aspect which is very crucial for us. Now, hopefully from the trend that we see, the second wave should slowly flatten.
Dr. Sangma brought to light the auditing of villages, which is an important aspect of eradicating COVID-19. Special importance should be given to the rural pockets, including awareness to the people.
Yesterday when I spoke to a few headmen of few villages and tried to know what is happening in the respective villages, I was little disturbed to hear that the village had number of members of the families were down with fever. Now there is a reluctance from people to come forward to get testing, to get themselves tested, and at the same time, the kind of conversation, the engagement with the community, which should be done in a more aggressive manner, is probably wanting. This is what I foresaw. I spoke to the concerned DCs of quite a number, 2 districts, where I received this information. So here we cannot have any sense of complacency. We need to have some auditing of every village. We have a system in place. We have the disease surveillance system put in place. It has been there for donkey's years. It is one of the most vibrant disease surveillance systems in the whole world. Therefore, it should be activated much more aggressively to know what exactly is happening in every village. Is there a reason for us to worry? Are there incidents of any cases which give us reason to believe or suspect incidents of COVID-19 in those villages? And therefore, that will give us a clear picture. That is what we have discussed. We have discussed with the district administration that is of crucial importance. Otherwise, the virus will be in our vicinity.
Dr. Sangma also threw light on how quick assessment and seeking help at the earlier stage of the disease is important to prevent loss of lives.
When you look at the death count, which is alarmingly high, which is quite disturbing, we shouldn't have lost so many precious lives, keeping in mind the proportion of the death count to the number of positive cases. Now, why is this? We need to actually understand so that we can prevent it. And when I looked at the number of those fatality, most of the cases where the patient has succumbed to the disease happens to be such that it has happened maybe on the same day of the patients having been brought to the hospital, or within 2 days, or within 3 days, or within 4 days of having been brought to the hospital for treatment. That means the patients are being brought only after the progression of disease has taken substantial toll on the patient. So the team here are unable to resuscitate and cure the patient, resulting in loss of precious lives. This is a matter of concern. Now, why this is happening? It can be because we did not have enough institutionalized quarantine centers, enough corona care centers, and another part is because of the home isolation strategy, wherein the patient and the patient parties are not being able to probably communicate properly or are not communicating properly. It can be either they are not willing to share all the information or they are not being able to share the information to get the correct advice as to when they should be bringing the patient to the hospital. So this is one area which we have discussed. The concerned frontline workers under the command of the GHS and the respective deputy commissioners, I hope they will address these issues.
He also put more focus on how saving precious lives is the responsibility of the government, not just by those affected by COVID-19 but any other disease.
Saving precious life will always be our responsibility. Now, when we say saving precious life revolves around all citizens of the state who may be inflicted by different diseases, not necessarily only by COVID-19. But why we are focusing on COVID-19 is because the incidence of the cases are unpredictable, because the transmission chain, if it's allowed to go on uninterrupted, then you will see unimaginable number of positive cases, and whoever develops severe symptoms, they need to be hospitalized. Now what we have seen is that the virus has been attacking people from all age brackets, whether children, whether adolescents, or whether elderly. We have seen that. So it has no discrimination from the perspective of age, nor caste, nor creed. Everybody can be a victim of COVID-19.
The leader of the opposition also mentioned that the hospital authorities should inform the administration in case they require anything to provide the required facilities to the patients.
Whether the teams feel that they have enough manpower or not, that should be heard from them and accordingly captured and accordingly addressed. That is how it should be done. Now, if you are running this hospital, I have to ask you, is it enough? Based on what you foresee and based on your experiences that you have gone through, if you say that it is not enough, then we must be able to do good to those deficiencies, whether it is in respect of manpower, whether it is in respect of other facilities, whether it is in respect of even supporting by other departments, because it's a war where you do not fight by only one particular department. It's a complete collective resolve which should be coming forward.
He spoke on the importance of vaccination to insulate the state from the third wave of the COVID-19 pandemic.
Universalization of vaccination is the crucial aspect which has to be addressed by the government. You have to ensure that everybody is well protected. Everybody is equipped with the arsenal to fight against this virus, because this war against this virus is to be won collectively. If you have vulnerable groups around us who are not well protected, which can be done only through vaccination and other measures, you will still have new hosts available for the virus. That means virus will continue to circulate around us and attack us at will. So therefore, if you want to defeat this enemy, the virus, the COVID-19, therefore you will have to have universalized coverage in as far as vaccination is concerned. Every citizen must be vaccinated, including the children. So all those necessary advanced measures, what is required to be taken, must be done by the government in due course of time. Besides other measures to ensure that we are able to insulate our state from the third wave. I personally presume, and if all measures can be put in place with the complete cooperation of the whole population, we may be able to at least insulate the state from the likelihood of the challenges of third wave. We can.
Dr. Sangma also said there was also a discussion on preparing the health sector to deal with the COVID-19 cases among the younger population as witnessed in other parts of the world. TNT Bureau.